Transparency is a critically important aspect of process improvement. If you're not measuring your success towards your goal, it's hard to know how you're doing and to keep up the momentum for improvement. In that sense, transparency is a way of an organization holding itself accountable to the standard of care it says it wishes to deliver. It does that by creating a kind of tension between the current state and the desired future state, where people can measure how we're doing against the goal we've set for ourselves, and that gap creates a tension, a creative tension, that causes people to want to succeed and do better.
Gathering data at Beth Israel Deaconess Medical Center is simplified really by the vast amount of administrative data and electronically stored data that we have available to us. So partnering with our colleagues in information systems, decision support, and the clinical teams, we're able to define measures and define populations and work with some structured data sets to produce on a very regular basis a list of quality measures that will monitor the changes that have been made, that will point out opportunities for further improvement, and will also reinforce to our staff that the work that they do every day is making a difference in the quality and safety of care provided.
One of the things that we realize is that it's very important to engage frontline staff in data gathering. So at the unit level, we develop very organic tools that are just paper-based tools where people audit practices or audit an improvement that we're trying to do. And then those are rolled up into an Excel document that we feed back to the staff on the units. So from the very beginning, when we're starting a performance improvement initiative or a quality initiative, we engage staff in the data gathering processes and they help to inform what are the best sources of the data that we need. There's a tension because we don't want to put too much of a burden on the frontline staff, and we want to engage them, but we also want to support them. And so we can support centrally reporting back the metrics in a way that's beautiful for them to see with run charts or dashboards. But we engage the clinical teams in the gathering of the data. And we initially just started by using poster boards. It doesn't have to be even anything electronic. We find that the more organic it is, the more engaged the clinical teams are.
The Transparency website has provided a focal point for the institution, and has promoted accountability and responsibility among the clinical teams as we think through very salient metrics to provide to our public, and also give some type of comparison. So when we are able to demonstrate our performance and it's good or better than what we were expecting, we take pride in that and certainly share that with our public. The Transparency website also has a principle where we have the promise that when we're not making the mark, when we're not hitting our goal or where we want to be, that we will share with our public our action plan. And for that, there's this constant emphasis on holding ourselves accountable and pushing towards an aim where we all can feel as though we're giving the best quality and safest care possible.